are a dental hygiene student and you're struggling with pharmacology, this video is for you. I'm a dental hygiene student, let's talk about it. So firstly, let's talk about the difference between the parasympathetic and sympathetic. So sympathetic is part of the fight or flight system, so you can think of it as stress for sympathetic. The parasympathetic system is for rest and digest. You can think of that as peace. Okay, like we said before, sympathetic is stressed, okay? So something happened to you and now your adrenaline is happening. That's why it's like the adrenal, right? Adrogenic, or however you say it. Because it's our adrenal glands, that's the things that's gonna give us energy for whatever is going to happen during this fight or flight response. So anyways, what happens during this thing? Okay, so one, your heart rate's gonna go up. Okay, you're nervous, something happened, so you're like, oh my gosh, my heart is beating out of my chest. Your heart rate is increased, and now you also have constriction. Your blood pressure is gonna go up. You are going to have no appetite, so your stomach is gonna stop digesting. You're gonna not go to the bathroom. You're gonna nothing. And when you get nervous, you notice that your mouth gets really dry, like, oh my gosh, I'm gonna have a speech. I need some water. Now, while all those increase, there's two things that I guess are the opposite of increasing, or the opposite of constriction, which is dilation. So during this, your pupils are going to dilate. So when you're in the fight or flight response, a lot of times movies depict that, like when you're stressed out, your eyes go really small, but that means that you're calm, funny enough. But your pupils dilate so that you're aware of everything going around you. That is called mydriasis. So you can think of dilate, mydriasis. I'm probably saying it wrong, but what also happens is that your bronchioles, they dilate, so you have an increase of oxygen. So that's very important to remember. During the sympathetic, your bronchioles, they dilate, okay? The sympathetic system also has a short preganglionic neurotransmitter that is going to be acetylcholine. Then there is a long postganglionic nerve transmitter, and that is going to be norepinephrine. Okay, now parasympathetic. Rest and digest, it's peaceful and calm. That's gonna go with the cholergenic. So when you're calm, you're zen, your blood pressure is gonna be lower, your heart rate's gonna be slower and calm. Your blood flow is gonna be increased. You're gonna go to the bathroom, you're gonna be digesting your food. You have an increase of saliva because you need to digest things. But we have constriction now. There's constriction in the bronchioles and constriction in the pupils. Constriction in the pupils is meiosis. A way to remember that is the meiosis, there's an O, and then constriction, there's an O. Okay, and then parasympathetic has long preganglionic neurotransmitters, which is acetylcholine, and then short postganglionic neurotransmitters, which is also acetylcholine. Because it's just calming effects, just calm. So like I said, for the long and short, so parasympathetic has a long preganglionic and then a short postganglionic, which is also called a muscarinic receptor, and that goes to the effector organ. Then sympathetic has short preganglionic, that's acetylcholine, and then it goes to the postganglionic nerve and has the norepinephrine. Those are the adrenal, the adrogenic. They deal with the alpha and beta receptors. Alpha 1 meaning the smooth muscles, the blood vessels, beta 1 meaning the heart. I think of like beating heart, I only have one heart, and then beta 2 is going to be the lungs. I have 2 lungs. Here's a little chart that shows what dilates and what constricts. And here's a little bit more in detail on why it's called certain names. So nerves that release ACH are termed cholergenic, or it can also be stimulated by the nicotine, which is why it's also called the nicotinic response. It's important to note that the ACH is terminated by hydrolysis of the acetylcholinesterase, which is like the enzyme of ACH. Hydrolysis is when the chemical compound is basically broken down from water, because hydro is water, lysis is like the breakdown of a cell. Okay, so cholergenic, what is that? Like I said before, it's the calming kind of neurotransmitter. That's going to be in the parasympathetic, right? So this is something that we take if something's increased, if there's too much constriction and we need to open up some things, like you're having heart issues, you need to take a cholergenic so that you can calm down and open up the blood flow. It can also be used for glaucoma, helping reduce the pressure in the eye, and it can also be used for people who have dry mouth, which you give them pilocarpine, so you can think of like when you're sleeping, your drool on your pillow when you're sleeping. Okay, so anticholinergic. This is going to be the anti-calming effect, or reducing what happens during the parasympathetic. So the release of ACH is not like inhibited or anything, it's just blocked. See, this is the ACH and then these are the blocks. So anticholinergic agents can be used for people with asthma, because remember, during the fight or flight response, which is adrenaline, right, instead of the calming cholinergic, so we want to open up, we want to dilate our bronchioles so we can breathe, right? So this is going to reduce the flow of secretions, because when asthma happens, your body starts to have an inflammatory response and secrete a bunch of mucus, so it clogs you up and you can't breathe, and it's just a lot of constriction. So you want to put anticholinergic to dilate your bronchioles. It can also be used during general anesthesia, so that when you have, your heart rate is going low, you don't have it so that you're constantly having a heart rate. Okay, for the sympathetic receptors, like we said, we have the alpha and beta receptors. Alpha has a smooth muscle, it causes vasoconstriction. The medications, what they do is they block the action of the neurotransmitter from doing it, so it's an adrenergic blocking agent. For example, the adrenergic would be the hypertension medication and heart medications, and also for asthma. And then B1 and B2, like I said, B1 is for the heart, B2 is for the lungs. So some dental hygiene considerations. If you have a patient that has xerostomia, you probably want to have their primary care provider refer them to get on some cholinergic medications so that they can have more salivary flow. If somebody's on a cholinergic medication, it's going to mean their blood pressure is low, so you want to make sure that you get them up slowly so they don't have orthostatic hypertension. Hypotension. Also note that the nasal decongestants are going to affect the adrenal receptors, so even though it deals with the respiratory system, what it's doing is it's constricting the blood vessels in the nose, so it's different from the lungs. Cholinergic is calming, part of the parasympathetic. You're going to be resting and digesting, but you're going to have constricted bronchioles, you're going to have constricted pupils. For sympathetic, you're going to have dilated bronchioles and dilated pupils, and you're going to not go to the bathroom, your digestion is going to stop. Anyways, I hope that helped you guys, and I'll see you later. Have fun studying. Bye.